Hi everybody, this is Dr. O'Leary from Team Chiropractic and Sports Medicine. Today we're going to be going over the nervous system and the effect of chiropractic care. So the nervous system controls everything we do. For you to communicate with others, for you to perceive your environment, for your heart to beat, lungs to breathe, even for a cut to heal. There has to be a signal between the brain and the body. So the nervous system consists of the brainstem, the spinal cord, and the nerves that run out of the spinal cord. The brain is made up of 4 different lobes. The front part of the brain is called the frontal lobe. That controls higher level cognition. It also controls how we do expressive language, as well as controls our motor skills. So the next part of the brain is the parietal lobe, which is the side part of the brain. That is for us to perceive our body's senses, so things like feeling, touch, pressure, and pain. Next is the lower part of the brain, which is the temporal lobe. The temporal lobe controls how we hear things. It perceives how we hear things. It also helps us control our memory. The last part of the brain is the back part of the brain, which is the occipital lobe. That helps us interpret what we see. Next comes the brainstem, which is directly under the brain, which consists of the midbrain, the pons, and the medulla. The medulla is on the very bottom of that brainstem. That controls our autonomic functions. Basically, the things we do subconsciously, like blood pressure, heart rate, and how we breathe. So you can imagine if you have a C1 misalignment at the very top of your spine, that's going to put pressure on that. You're going to have trouble with things like sleep and focus. Next comes the spinal cord. That runs all the way through the spinal column. And what comes out of that is nerves. That goes to different parts of the body. The next part of the nervous system is broken up into 2 different sections, the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system activates your fight or flight response, so your body can be ready to do strenuous activity. This goes from the levels of T1, right at the base of your neck, down to L2 in your lower back. The parasympathetic nervous system is the things that you do subconsciously, so things like rest and digest. That's going to be concentrated at the base of your skull, as well as in your sacrum, in the very base of your spine. Pressure on these areas will decrease their function. So if you have a subluxation at that point, you're going to have trouble winding down to rest or getting your body ready to do some movement. So the spine controls everything. Each nerve root controls a specific area of the body. It carries information back and forth between the brain and that specific region. When a nerve root is irritated or compressed, the function of that area it supplies decreases. For example, if you have a subluxation at the T6 level, basically your mid-upper back, those nerve roots go to the stomach. So if it's irritated, the stomach won't be able to function as well. It can lead to things like heartburn and indigestion. When you have a subluxation at T1, basically at the base of your neck, that innervates the shoulder and the upper arm. So when you have irritation there, the upper arm and shoulder can't function as properly. You'll see muscle weakness and altered sensation. B.J. Palmer said it best, "Nature needs no help, just no interference." Our bodies have been designed to heal themselves. We just have to remove the interference. The goal of chiropractic is to locate, analyze, and correct subluxation in order to remove interference of the nervous system and restore normal function. Subluxation is what we have been discussing throughout this entire presentation. It's when a vertebra shifts out of place and puts pressure on the nerves and the spinal cord. It interferes with the function of the central nervous system, alters the body's chemistry, directly causing degeneration, things like arthritis and degenerative disc disease, as well as just disease in general. We call it the silent killer because it causes symptoms down the chain from where the actual problem is going on. The site of the root cause of the problem is often asymptomatic, and we adapt to symptoms through medication, shots, surgery, and drugs. The normal position of the spine is straight up and down from the front with no rotation, and it has curves from the side. The cervical and lumbar region, so your neck and your low back, have a curve in the front called the lordotic curve. The thoracic spine, so your mid-upper back and the sacrum, have a curve in the back called the kyphotic curve. Proper curvature of the spine is important because without it, the spinal cord is stretched and pinched. We'll use our hand as an example. Your neck's supposed to be curved back like this. You can pinch your hand pretty easily like that. But when you have something like forward head posture where you're leaning forward like this, you can't pinch the skin. That's the same thing that's going on with your spinal cord. If you have that forward head posture, it's being stretched out, your brain can't communicate with the body as well as it should. With normal positioning of the spine, joints can move properly and the nervous system can be free of interference. How we detect abnormal position of the spine is through patient presentation, palpation, which is us manually feeling the spine, as well as through X-ray. When we examine X-rays, we can literally see the misalignments in the form of improper curvature, spinal shifting, a lean, or a rotation. We can also see degeneration like arthritis and degenerative disc disease, or signs of degeneration to come. Degeneration comes from a joint not moving properly for years on end. So ideally, if we can keep the joint moving and correct the structure, we can hold off that degeneration or stop it in its tracks. In our office, we have a system that allows us to compare patients' X-rays to normal positioning. We measure how much a patient's structure deviates from the normal 45-degree curves, the difference in pelvic height, rotation, and tilt of the vertebra, as well as the level of degeneration. This is how we determine how and where we need to adjust. Subluxation develops as a result of stress on the body, whether that's physical, chemical, or mental. Physical stress can be a macro trauma like a sports injury or car crash, or it can be a micro trauma, things like poor posture or lack of movement. Chemical stress comes from things like poor diet, dehydration, and exposure to toxins. This creates inflammation and muscle tension, which shifts the vertebra out of position. Mental stress comes from emotional trauma and causes the body to release stress hormones, which do the same thing as chemical stress. It creates inflammation and muscle tension, same thing, shifts the vertebra out of position. So how do we correct that subluxation? We make an effort to be more mindful of having proper posture throughout the day. We live healthily following our 6 essentials, and we get a regular spinal checkup to correct our body structure. When our body is without interference, we are self-healing and self-regulating. Our body is designed to heal itself, as long as we have no interference. You weren't born with a deficiency in medication. You are equipped to manage illness, pain, and inflammation naturally. Another quote from B.J. Palmer, he says, "Medicine is about disease and what makes people die. Chiropractic is about life and what makes people live." We don't want our patients to simply feel good because symptoms don't tell the full story. We want our patients to optimize their health and live life to the fullest. Now, we already touched on the 6 essentials, but we'll go through them real quick. Feel free to pause it and read these over on your own. But we want to touch on spiritual, mental alignment, physical alignment, nutritional alignment, exercise in alignment, rest in alignment, and remove chemical stress. All sickness and disease comes from deficiencies and toxicities. This is how we combat that. The medical world is stuck on treating the symptoms and over-prescribing medication, which causes toxicity. Our goal is to allow the bodies to naturally heal itself and work to the best of its ability, not just treat the symptom. I want to thank you for watching today's nervous system workshop. I hope you enjoyed it. Our goal is to maximize the health and healing of everyone you know. So please feel free to refer someone to our office. There's a great discount of just $47, which includes an entire examination, including x-rays, an adjustment visit, as well as a full doctor's report.